Hi, I'm Dr. Arnold Malcolm. I'm Chairman of Radiation Oncology here at Vanderbilt University Medical Center. I've been a radiation oncologist for about 40 years plus, and I've seen all the new innovations in the techniques of radiation therapy over 40 years. It is tremendous. It keeps changing every single day. We here at Vanderbilt stay abreast of all those techniques. We have an outstanding multidisciplinary team of radiation oncologists, medical oncologists, surgical head and neck oncologists. It takes a village to do a great job in this disease. This is not a disease in which one person can take care of a patient. I think all three modalities are imperative in making sure patients get the right treatment in all the aspects that are needed to treat this disease. So let's talk about radiation therapy in regards to head and neck cancer. I think most people don't recognize the fact that the new treatment we talked about, IMRT, intensified modulated radiation therapy, was focused on head and neck cancer. That's how it all started. And the reason for that is because the techniques that we utilize to treat head and neck cancer are using external beam radiation to treat the tumor in the site that it may lie in, including the floor of mouth, base of tongue, larynx, etc. However, there are major structures around those areas, mostly the spinal cord. So IMRT, which we do here at Vanderbilt and many other centers, was specifically designed and around head and neck cancer, and then it has been moved on to other diseases like prostate cancer, but really head and neck cancer has actually been the leading disease that has helped move radiation therapy forward in the future. Another aspect I should talk about us here specifically at Vanderbilt is that unfortunately, like all cancers, they can return. This does occur in patients with head and neck cancer. We have taken upon ourselves to be aggressive when possible in retreating patients, recognizing that we ourselves as physicians are taking risks to help our patients. We're probably one of the major centers in this country who are willing to treat patients in very significant and difficult circumstances. But we use all the modern techniques. We have several physicists to help us work on all these things. We use many, as we talked about, IMRT techniques to protect normal tissue or tissues that have already been irradiated because we are re-irradiating those patients. They're just tough, difficult cases to take care of. Another thing I should say about radiation therapy for head and neck cancer, it, from my opinion, is one of the toughest areas to treat because all of the normal structures that are going to be disrupted with the course of radiation. It is one of the toughest areas as a radiation oncologist to convince, work, control a patient to tolerate this aggressive therapy because it can be life-changing, disruptive, at least from an acute point of view, and perhaps even chronically because of the tissues that we have to treat.